Hello, good evening, everyone. Welcome back to My Every Offenses and welcome to our webinar. It's been great to have you here. Dr. Laura García de Miguel is with us, and I'm really happy to have you here. As I've mentioned, it's been a while to simply have a webinar with you, and we've done many webinars with you before, so I'm glad we are going to discuss this topic. Hello, how have you been? I hope all is good and you are ready to educate us as always.
Hello, thank you, Caroline.
Thank you so much for joining us. And as you already know, we will talk about an interesting topic. We haven't discussed this topic, to be honest, before, and I'm really happy that we are going to discuss this today. And we will talk about obesity and the impact of obesity on infertility. And of course, as always, you know, we will start with our presentation on this topic, but afterwards there will be time for your questions. Please let us know that you can hear us loud and clear, and we will be happy to take care of all of the questions right after Dr. Laura's presentation. Let me just remind everyone that Dr. Laura Garcia, she is the medical director from Clínica Tambre, located in Madrid, and she has been with us before, and I'm really looking forward to our session today. And thank you so much for your comment here. Thank you so much. Welcome everyone from UK, but I know there are other people from other countries as well. So thank you so much for joining us. And as always, please remember this is being recorded, and we will be happy to take care of all the questions right after our presentation. So if you have anything else you wish to ask directly, Dr. Laura will be here for you. So please just type the questions in the chat, and after the presentation she will definitely take care of those as well. And yeah, thank you so much. I see that more people are joining, and I see that you are from Netherlands, Sudan, and London, of course. So thank you so much for joining us tonight. It's lovely to have you here. I'm sure it's going to be an interesting session, and I think that we can go ahead with the presentation right now. Let me just show this to you, and I think we can start. Dr. Laura, ready for it?
Ready?
Perfect. Let's go ahead then. Thank you so much.
Today we will discuss about this topic, body mass index and fertility, addressing on the impact of obesity in fertility. So the summary of this presentation today, we will have an introduction about our clinic, the impact of the overweight on fertility, overweight and assisted reproduction treatments, how it can impact, and pregnancy risk in overweight women, and lifestyle and the importance of body mass index. In our clinic, we have always the objective to have an accurate diagnosis to achieve pregnancy for each patient. We are specialists in complex cases. Of course, we have a long history. We have more than 45 years experience, and we work with patients from all over the world, more than 80 countries. And we've been capable to give birth, create families, more than 15,000 babies. We are excellence in advanced reproductive medicine, and we are a specialized and multidisciplinary medical team. We use the best and the latest technologies. We are pioneers in artificial intelligence, and we have our in-house laboratories. Always accompanied, this is very important in Tambre. From the first contact, you will always have your coordinator and gynecologist specialized in reproductive medicine. You will have a tailor-made treatment design, always individualizing and explaining all steps. We have an international and multilingual team that will take care in your mother tongue. And Our goal is always to help you with our challenge and our commitment. Advanced technology, it's very important and crucial for us because we have the state-of-the-art laboratories and operation theater with the latest technologies. We are excellence in advanced reproductive treatments using progenetic diagnostic, Jerry time-lapse incubator, Phenomodge to have the best assignation of donors to recipients, Comet Fertility to study the quality on the sperm, RI Witness to make sure that we are working with the correct samples, and also, if necessary, the S endometrial solution to investigate about infections and receptivity. We have the different numbers regarding body mass index. The ideal is to be at the normal range, so 18.5 to 24.9. Less than 18.5, it's underweight, and we can have problems, mainly such as problems of ovulating. And if we go up and up, we will have overweight 25 to 30, obesity 30 to 35, and severe obesity more than 35. Of course, if we are overweight, we can also have problems with anovulatory cycles, such as when we are on the weight, but also we can have other impacts. Why weight matters in fertility? Of course, because it affects both fertility and pregnancy outcomes. It is important to explain that in 2019, 52% of adults in Europe had overweight. And there is always BMI and fertility connection. So if our weight is not at the ideal range, we have more risk of having problems with fertility. Remember, the ideal BMI, it's 18.5 to 24.9, and that is how we can have the higher chances of conception. And if we have BMI over 30, conception difficulties and increased risk in your pregnancy, such as diabetes, high blood pressure, CS. How is that impact? We have hormonal imbalance because we have an excess in estrogens, and that could block the hypothalamus and hypophysis secretion of hormones. It can affect our menstrual cycle, such as I was explaining, because we have higher frequency of irregular cycles and cycles that are not ovulating. At the endometrium, it could also have more risk to create polyps and have more difficulty to have a good development. And then there is a link with PCOS, polycystic ovary syndrome, common in overweight women, and this affects also ovulation and egg quality. Sperm production. So if we have the sperm, the man that is having overweight, we can have lower quality and less quantity. That is something very common found at the practice. Also, mobility and morphology could be affected. We could have reduced fertilization ratio and less quality of embryo. And of course, if we have healthy BMI in men, this can improve our outcome in fertility treatments. Regarding treatments such as IVF, there is an impact if we don't have the ideal weight, because We could have lower hormonal response. It means that obesity reduces the stimulation effectiveness. And that's something very important to talk with your doctor. If even you have a good ovarian reserve, but you are overweight, the dosage should be higher. Otherwise, the response at the treatment could be reduced. Complex procedures, there is an increased risk and difficulty in follicular egg collections and, of course, embryo transfer. And there are limited outcomes with lower fertilization rates, fewer quality of embryos, and reduced implantation rates. That is the most important. Remember, there is much evidence reporting less implantation rates. Recommended BMI for treatments should be less than 30. But we know sometimes this is not easy, and this is very hard for some patients. So how pregnancy can be affected due to obesity? We have maternal complications such as increased risk of hypertension and gestational diabetes. Birth risks, we have more risk of CS and preterm delivery. Perinatal mortality, we have more risk of pregnancies with such other risks. And baby's health, we have a little bit more risk of malformation and high birth weight when they are born. So it's extremely important to have a good lifestyle and try to not have an abnormal BMI. So having a balanced diet and exercise, maintaining a healthy weight improves ovarian and sperm function. The weight goal, remember, before pregnancy, it's to have between 18.5 and 25. Lifestyle changes, it is extremely important to have a balanced diet and physical activity. And the benefits, if we have a healthy BMI, this will reduce risks and improve fertility success rates. Of course, this is not the main cause if you're not getting pregnant, but if we try to reduce BMI, if we try to improve your lifestyle, probabilities of success will be higher. Thank you for your participation today. We give you the opportunity to ask whatever is important. And please, if you have any specific information regarding this subject or any other thing at your case, please email us and we will be delighted to help you.
Thank you so much, Dr. Laura, for introducing and, of course, explaining how it works, why BMI is important, why being overweight how it can actually, of course, have an impact on infertility, on your fertility, sorry. And of course, now we will go for your questions. And of course, there are a few questions right here. So thank you so much for those already. And if you have more questions, you know what to do. Just type those in the chat. And now we will go with them right now. So I will go to the first question that we have right here. My question is, what is the optimal BMI range, and is 28 too high?
The optimal rate is 19 to 24, 25. So 28, it's a little bit higher. It's not that much, but if we try to work in parallel with treatments of fertility, but also with diet and changing lifestyle, we could have much more outcome.
Okay, thank you so much. That's crystal clear, I think, here. And next question, of course, there will be some questions in regards to not about, I mean, let me just read it for you. So my weight is 76 kilograms and my height is 1 meter and 69 centimeters. So planning for IVF in a few months. Any advice here? 76 kilograms and 1 meter and 69 centimeters.
I'm going to do the conversion for
Mm-hmm.
body mass
Okay.
index.
That's
So
better. Sure.
let
76 kilograms. Yeah.
let me have a look. I need my calculator.
Sure.
So you please confirm.
76 kilograms and 169. This is the height.
76 and 169.
Mm-hmm.
So this is a BMI of 26.6. So it's nearly normal, but if we try to exercise and try to reduce a little bit weight, that would be even better.
Definitely, of course. So there are some options. So I just to understand, of course, if you have someone like this in your clinic, when someone comes up here and would like to, go ahead with the treatment, the first step is simply to reduce the weight, and then you can go forward, right?
It really depends because sometimes it
Mm-hmm.
is very frustrating to explain patients that they cannot start with the treatment until they are
Mm-hmm.
not.
Yeah.
And of course, this VMI 26, 28, this is not extremely bad, and we would not postpone treatment. We would give the opportunity to work in parallel with any dietitian and trying
Mm-hmm.
to exercise more, but we would not explain that it's obligatory to postpone the treatment. Just if they prefer to prepare a little bit better before treatments, then we can do it.
Oh.
Otherwise, it's more to work in parallel.
Mm-hmm. Okay. Thank you. Just wanted to, make it clear for everyone how it works, but thank you so much. So, the question is here from Catherine. How does a BMI over 25 affect equality?
So it's not clear exactly why the metabolism can have a problem in the egg quality. Again, more than 24, more than 25, it's not a big overweight. We are considering more risk when it comes to obesity because, of course, the environment from the endocrinologist perspective, it's not easy. And of course, we can have many uh, abnormalities in the hormones imbalance, and then we have more risk of having anovulatory cycles, which means that we have periods but we don't ovulate correctly. So it means that the follicle is not recruited and it's not active correctly, so then we cannot have probabilities of pregnancy with natural conception.
Mm, okay. Thank you for that. And there are more questions, of course, in regards to this. So, how does a BMI in overweight range, example BMI 28, let's say, affect stimulation when, yeah, medication stimulation? Sorry.
So the stimulation, as I said during my presentation, it's very important to select the perfect dosage. And this is not only regarding the ovarian reserve, but also regarding the weight. For instance, this morning I had a lady that she wanted to do IUI because she is very young and she's not having infertility issues. She's just a couple of women. So we said that she has a very good AMH, but by contrast, she was overweight. So that it's important to discuss and explain options because if we only take into consideration the ovarian reserve, the anti-Mullerian hormone, but not the weight, then we can have less response and obtain less probability of pregnancy.
Mhm.
It's more important when it comes to IVF stimulation.
Okay. Thank you. Thank you so much indeed for this as well. There are more questions like that, I would say, because there's someone, Julie, would like to simply, it's a short one. Can't lose weight due to PCOS. Any advice in this kind of situation, PCOS?
Yes, I know PCOS is extremely frustrating because it is the main cause of the difficulty to conceive, but also It's not all PCOS women, but majority, they have impacts in weight. We could talk and discuss with endocrinologists and see if we can use any treatment to change the metabolism of glucose and insulin, such as metformin. Also, if the overweight is extremely hard and very difficult, then we can start considering new diets such as fasting, intermediate fasting, that it's extremely good and it is a benefit for the health. And also we can work with endocrinologists using these new injections, these new medications that help women do not to eat that much, and then with a very expert approach they can reduce much faster.
Okay, thank you. Now I will show you next question here. Okay, so I am always concerned when BMI is mentioned. Some people, Asians, Africans, for example, generally do not fit into the BMI range since BMI is based on European heights. Are the implications the same on European and say Asian who have the same BMI? Anything you can add on that? I'm sure there are people coming from all over the world to Clinica Tambre, right?
That's a very intelligent question and subject. Of course, I know sometimes I work with African. Their complexity is extremely different. So I'm not that hard with these women because I know that their complexity and their genetics it's much different compared to the European. But I always try to be honest and explain if they can reduce a little bit, if they can change lifestyle, if they can do whatever it's in their hands, they will help me. They will help me to have more probabilities and to arrive to the pregnancy. The sooner the better.
Yeah. Thank you. I think that's clear. So of course we need to make sure that of course it's taken, let's say, individually, right? It's every case is different, but of course it's important to simply follow that as well. All
Yes, in
right.
this context, Caroline, I want to explain that at Clinica Tambre, we will always open our doors for everybody because it's extremely frustrating and desperating some patients that they cannot find any clinic that accept their case. Of course, sometimes we try to um, reduce weight before starting.
Yep.
Sometimes we create embryos, we stimulate ovaries, but then for the transfer, which is the main impact, the implantation, then we recommend to postpone, but at least they start to feel that they are moving and they are not like not doing anything, which is very difficult then to have the motivation to start with, changing lifestyle.
Of course, makes perfect sense. Thank you so much for this as well. All right, let me just go for the next question. So, should I ask for, I'm not sure here, sorry, drug dosage for egg collection and transfer if BMI is 30, weight is 40, as you can see, height is 5 feet.
Yeah,
Okay, I think
of
you can see
course,
it.
Julie, it's always, important to explain to your doctor your weight, your height, not only your ovarian reserve, not only the AMH and the antral follicle count, but also these parameters that will help to select the best stimulation treatment plan for you.
Okay. Yeah, thank you. Thank you so much for that as well. And let me go for the next question here. So when the egg donor has a normal BMI, but the recipient's BMI is not, what challenges do you expect in regards to getting pregnant, keeping the pregnancy and the birth?
So this is always a possibility, and of course, the impact will be reduced implantation rates and higher risk of diabetes, high risk of uh, high blood pressure disorders during pregnancy. So that's why it is so important.
Okay, of course. Again, thank you so much. Catherine has a question with a few of the details. So again, let me just show you this. Just give me a second. Okay, so I've fallen pregnant twice naturally. Unfortunately, my first baby was induced at 40 plus 6 when my pregnancy weight was, when I was pregnant, it was 92 kilograms in December 2021. My baby died of neonatal asphyxia after 1 week. I'm worried my BMI was part of the cause, and I then fell pregnant earlier this year in January when I was 77 kilograms after I canceled IVF round. Unfortunately, I had a miscarriage at 11 weeks due to trisomy 18. I have since turned 43 and I am worried it is too late. Can losing weight and doing from a BMI of 28 to say 25 help at this age?
So
Thank you so
I'm
much.
extremely sorry, Catherine, for what happened to you. If you had a consultation with me, I will always explain that the problems with weight are not the principal cause of problems of infertility, of course. And also, this is not the case of the asphyxia. So, of course, when we are having more weight, there is a risk of difficulties at birth, but asphyxia, this is something that it's multifactorial, and you should discuss with the experts that were at your delivery. So 100% it was not your fault. And the same for the miscarriage that you had recently, which is because of a problem at your chromosomes. So nothing to do with your weight. Of course, if you reduce weight and you work in parallel with a clinic, then your probabilities to have a baby will be higher. But unfortunately, right now, the main concern is the age and how this impacts on the fertility outcome because of the reduction on the quality of your eggs.
Well, thank you so much. I hope that helps. If you have any follow-ups, you know what to do. And there are more questions coming up. And again, another question is with some details right here. So let me just show it to you. So I'm planning to go into IVF with egg donation in 3-4 months. Right now, my BMI is 31.6. I remember someone said many years ago that losing weight in short period of time prior to pregnancy is not the best for your body. Is that correct? And I lost 16 kilograms last year, but then I stopped during pregnancy and it's lost this summer and fall. And I would like to go on before next IVF. Anything you can advise here?
So that's not correct. So to reduce weight, if we are overweight, of course, always controlling with an expert, having blood tests, having supplements if necessary, is always very welcome. This will never be a risk. And even with patients that they are overweight during pregnancy, they can also continue reducing weight. So it's not a contraindication to go on a diet during your pregnancy. So this is always safe. And if you are having this diet with an expert that can control that you're not having any risk, this is not a problem, and this is always welcome to reduce weight before a pregnancy.
Okay, I hope that's clear. So, of course, as long as you are cooperating with some dietitian, I think it's safe to say that you can continue. So, thank you so much for that. I hope that helps as well. Let me just go. More questions are in. And when BMI is 33, all hormones are in balance for all ovulation tests. They are positive, no endometriosis, no PCOS. I eat healthy, no processed foods, exercise regularly, and in these circumstances, is weight still a factor for becoming a parent? If you can.
So what we
advise.
can explain is that implantation ratio, it's always less probable than if we have normal weight. So the recommendation will be to always try to reduce weight, go on a good lifestyle, and change lifestyle to try to reduce a little bit your weight.
All right. Again, thank you so much. All right, and Karen would like to ask, so BMI, my BMI, right? It's 30-31, AMH 6.2 picomoles, age 39. I believe I should for medication FSH, LH2. Let me just show you this. Menopause only, what dose would you advise? Or alternatively, should I consider Pergoveris, which I've heard is good?
Yes,
Maybe
when it comes to more than 38 years old, we traditionally use Pergoveris. This works very good. And also because menopause now, it's not possible to buy in Spain. So we use Pergoveris very frequently. And regarding 6.2, I need to have a conversion in my units. Sorry. 6.2 picomoles, that is 0.8. So that will be 300 units. 300 units, for instance, of Pergoveris. Supposedly more than 300, even with increased dosage, will not impact in a high response and more eggs. So we consider 300 the maximum dosage, and that's what we recommend.
Okay, thank you once again for your clear answer here. And let me show you the next question. So what impact does adenomyosis and endometriosis, what is the impact with uterus and ovarian
So
reserve fibroids?
adenomyosis and endometriosis, these are one of the major causes of sterility. Endometriosis impacts in quality and quantity of eggs, so this is impacting in IVF, whereas adenomyosis, it's impacting in the uterus, in the walls of the uterus, and this is reducing the probability of the implantation ratio. So we need to work very hard with these patients and see if pregnancy with IVF is feasible, and if we need to use the specific protocols to reduce this activity of adenomyosis and make the embryo more capable to implant.
All right, thank you so much. And now I will show you the next question, okay, from Angelica here. So I'm 43, severely obese. In the last 2 years, I've done 4 rounds of egg freezing and plan to do another one in 3-4 months from now on. I also plan to lose weight significantly in the following 4-5 months. Is it dangerous to lose a significant weight, let's say plus 30 kilograms, in a short time frame?
This will always be more risky if we continue with overweight. This could have an impact into our possible cardiac disease, such as a stroke and other things. So this is always safe to reduce weight. And even if we need to reduce 20 or 30 kilos because we are in severe obesity, this will not be a risk, 100%.
All right, thank you for reassurance here as well. This is a question that definitely comes up a lot. And in regards to your answer, there is a follow-up in regarding menopause. Why is it no longer available in Spain? Are you able to tell us?
Yes, so menopause is produced abroad, and unfortunately, there is a problem with the legal creation of that. So we believe probably in 1 year or 2 years, they will be capable to continue creating menopause. So there is like a worldwide situation with menopause. So patients and countries that they still can find menopause, it's because it was already created. Right now, we need to wait a little bit more. We know that this will be solved. And that is a very good medication, but this is a legal situation.
Yeah. All right. So this is the, let's say, the only reason, right? So it's nothing that. So it's possible to still, it's still used in other countries.
Correct. Yeah.
Yeah. Okay. Thank you for making clear. And now 2 questions are left. If you have anything else, you know what to do. Just go ahead, type those in the chat. And now I will show you the next question. What are the blood tests you mentioned should be carried out when losing weight?
So supposedly we recommend to do like liver function, TSH, and also to check if there is any kind of anemia, control of vitamins, to make sure that the body is in perfect conditions and this reduction is not impacting in our um, good health.
Okay, I think that's pretty clear as well. And again, if you have anything else you wish to add, you know what to do. And possibly our final question for today. So let me just show you. This is definitely an interesting question. I think you've seen it before. What is the least ideal BMI you have managed to deliver a healthy baby?
So I understand this is like what is the maximum ideal BMI.
Yeah,
So of
I believe
course,
so.
as I said, I have had many patients that they were not capable to reduce weight. So I have many patients that they are obese, and again, I cannot say I cannot go ahead because they feel extremely sad. I accept. So I can just say that I even have more than 38 BMI, which is not the ideal from the medical perspective, but this is always a balance between psychological point of view and helping this woman to create her family.
Okay, I think that's clear as well. So it's hard to say. It's not like it's always personalized, right? It's not for, let's say, everyone, of course,
That's
right?
it. It
This
is
is the
to
case.
individualize and to also understand if there are other risks in parallel or if that is not the case.
Okay, thank you. And in the meantime, we did receive 2 questions. I think we have still time to answer those. So I will show you because there are some details here. So my AMH is 0.53 or 3.8 picomoles. I turned 43 in September. I just injected 225 Meriofert and 225 Postimon on day 3 stimulation. I'm trying to one last round of IVF and still have 2 frozen blastocysts from 2023. In all of this, if all this fails, I will have to turn to a donor egg. What is the maximum BMI you recommend for donor egg transfer? 25?
Again, the ideal, we know that the ideal it's 25, but we know that there is a big impact in our society of obesity, and we cannot just close our doors in 25. So the ideal would be to have less than 25, less than 28. Where it comes to more BMI, I try my best to explain it's so important to not overpass the 32. But then, of course, we need to individualize.
Yeah. Okay, thank you. Again, I think that was helpful for you. Okay, and the final question, I believe, what does the research show to be the impact of weight on implantation? Any studies you can share?
Yes, of course, if Cassie it's interest, she can contact to our clinic. And of course, this is mainly because it influences the environment of the endometrium. It can change the level of progesterone. It can create an ovulatory environment. So there are many hormones that, in the event of obesity, are not well controlled, and then we have less probability of implanting.
Okay, thank you so much indeed. And I just saw one of the comments, no questions more, but Catherine would like to say thank you. I'm hitting the gym tomorrow. Fingers crossed, of course. And I do believe it was helpful. As I mentioned, it was our final question. Okay, one more I think we can still answer. Does increasing progesterone supplementation help?
Yes, of course, it could be, helpful for all patients. Again, what I can explain from my perspective is that obesity, it's never like the crucial cause. There are always like multifactorial causes. And this is just try to understand the person we have in front of us, try to explain and adapt a lifestyle, diet, exercise to try to have the best outcome. But don't feel guilty. Don't feel the obesity, it's a unique problem. This is only to try to reduce risk for your health at your future and also during your pregnancy.
Thank you so much. I believe that was the perfect question and perfect answer to for our end for this event, because of course I think that the main message is don't get discouraged, of course. So thank you so much for joining. I thank you for your expertise, Dr. Laura. Thank you so much. It's been great to have you, and I think that we will be finishing for today. But any final words before we finish? Anything else you wish to add?
That's it. Just rely on your clinic, rely on your doctor, and always try to help um, to work as a team. And of course, the clinic can work their best with your outcome, with your embryos. But if you try to work in this, routine to do exercise, to try to reduce weight, don't feel this is a risk for you to reduce weight before a pregnancy. This will be much safer, and you will have much more probability.
Thank you so much indeed. I believe that we can finish for today. But of course, as Dr. Laura already mentioned, if you have any other questions or there are some things you would like to simply discuss with the clinic, you can get in touch with them directly. You can get in touch with me, and we'll be happy to forward any questions as well. But it's always best to simply get in touch directly, and I'm sure the Clinica Tambre and the team at Clinica Tambre would be happy to help you out. Thank you so much. I'm really happy that we've been able to discuss this topic. It's an important topic, and thank you so much for making it clear, loud and clear, I think, for everyone, that there are ways to simply reduce your weight, but of course, you don't need to be feeling any bad about it. So there are ways to simply try and have a healthy baby as well. So thank you so much. Have a lovely evening, everyone. Take care and speak to
Bye
you soon, Dr.
bye.
Laura.
Bye
Thank
bye.
you. Take
Thank
care.
you.
Bye.